Hi there, this is the low back pain presentation, and this is formally done as a webinar, but I wanted to extend this information to the YouTube platform. So my name is Dr. Rebecca Schuck. I'm a physical therapist, and we're going to be answering some specific questions about low back pain. So specifically, we're going to be going through the causes to secondary low back injuries and some of the most common diagnoses for them. We'll be going through different lumbar spine structures and anatomy and how this may relate to your symptoms for the most common diagnosis seen. And by the end, I'll be sharing my 10 best tips to help start your low back pain recovery program. So without wasting any more time, let's get started. Okay, first up, causes to low back pain. So we categorize this into two categories first. First is primary, which is congenital, meaning that this is something that you were born with. Secondary means that this is something that there's an etiology or cause to your low back injury at some point in your life. And we're discussing secondary low back pain injuries. So for secondary, there are 5 main categories for this, and these are mechanical, nonspecific, degenerative, inflammatory, oncologic, and infectious. So we're just going to be discussing the top 2 in a little bit more detail. So with nonspecific and mechanical classifications combined, these encompass 90% of low back pain injuries, and this is a very large number to keep in mind. So mechanical means that there is some sort of structural damage to the lumbar tissues surrounding your low back. And this can be in range of like a fracture, like a spondylolisthesis or spondylolysis, your muscle strains, your discogenic or disc herniation injuries, and even pregnancy is a part of this group for abnormal loads during this time period. Now, nonspecific means that there is no found tissue damage, which is found in an MRI or X-ray from your radiologist. So this is a common story, and this is actually more common than the mechanical part of the classification, where somebody comes in to see a physical therapist and they are in excruciating pain, but the radiologist has an impression on their MRI that there is nothing significant to report. Now, this is pretty common because of possibly a couple of reasons. One is because the image being taken is in a static position. You are in a static position and not dynamic when your symptoms might be onset. So this is possibly one reason for why the image can't capture everything to correlate to your symptoms. Another reason is because everybody's pain experience is different, and we all develop this throughout our life. So our pain experience, it may not always correlate to the structures we see damage on imaging. And this is very well known for other types of diagnoses ranging from the shoulder, the knee, the back, etc. So the good thing from physical therapists is that we don't rely on imaging with a method called the McKenzie method. So this method is utilizing repeated movements to help reduce or produce your symptoms, and we're figuring out mechanical means or movements to help reduce your spine low back pain symptoms. And of course, you have to be certified in the McKenzie method. So the second classification is degenerative, and this encompasses diagnoses like osteoarthritis, spinal stenosis, degenerative disc, and joint diseases, which is called your spondylosis. And this just means that there's an abnormal growth or loss that is causing your pain. Now, there is a lot of evidence to show that there's a high correlation to age for this degenerative group, but the literature is still uncertain about this. And one thing that is popular that I see as a clinician is that there might be somebody who has both degenerative and a mechanical etiology going on. So clinicians have to consider this, and we have to work with both etiologies. All right, moving on to easy spine anatomy. Okay, so the way that I broke this down is going from the most superficial anatomy structures, and we're going to go deeper and deeper regarding the lumbar spine. So we're first starting with muscle and fascia tissue, which is considered elastic tissue because it can constrict and it can elongate based on a volitional movement. So the purpose of muscle tissue is to add stability, hold erect posture during our dynamic movements. Now, looking to the right over here, I don't want anybody to get lost, that we're not meant to I don't want you to feel like you have to memorize everything, but just showing you a gross view and how much muscle is supporting the lumbar spine. So we have the backside here that ranges from the top of the ilium all the way to the back of the head, or the occiput. We even go a little bit deeper between each vertebrae. Then we have our abdominal musculature, which is your obliques and your abdomen. And then we have even deeper your hip flexors. Now, if these muscles are injured, we're going to be having symptoms of tenderness, swelling, stiffness, difficulty in using the muscle, spasms, or even some bruising. But our expectation for healing is going to range from 0 to 72 hours. Now, if it's going a little bit longer than this, it might be a little bit larger of a muscle strain, but we shouldn't expect it to go over 4 weeks or for it to even be episodic. This usually means that something else is going on that is not muscle or fascia related. So this brings us to the lumbar spine, and I just wanted to show a gross view going from L1 to L5, and that last one is L5 over S1. And a key point here that I wanted to take away is the lumbar spine is a concavity compared to convexity like your thoracic spine, as you can see up here. We call this concavity a lumbar lordosis, and this is crucial in trying to maintain during our sitting and standing postures. If we start to lose this, radiologists during an MRI or X-ray might say a loss of a lumbar lordosis or excessive lumbar lordosis. So, or of course, normal. But the point is to have a little bit of a lordosis on our spine during those positions. Okay, so now we're moving into ligamentous tissue that is adding more stability and preventing excessive range of motion from happening at the lumbar spine. So this is very important for gymnasts who are doing back bends all day. And you can see this at the right for the white tissue surrounding each of those vertebrae. So a popular diagnosis that we see is called a facet joint hypomobility or facet joint injury. And this is when the cartilage surrounding one of the joints on the lumbar spine, right in here, is feeling like it's locked, and there's a central point of pain, but there's no sciatica or radiating symptoms to your lower extremities. They may also feel like a loss of movement in certain directions, and this can be very prevalent for people who are working at a laborious job and they have to do a repetitive movement, or even for an athlete during a sport. So our expectation is we can unlock this joint, which is utilizing different methods and possibly even a manipulation. We should expect a full recovery as long as they're not repeating those movements, or they learn how to correct the onset for this impairment. Okay, so now we're going to be considering the vertebrae and how it relates to the intervertebral disc. The point of the disc is to add shock absorption and to prevent a bone-on-bone or arthritic changes happening. So, and now we're moving into more of the mechanics of this, and I like to explain this by a jelly and cookie analogy. So if we want to think of my hands as the vertebrae, and in the middle is going to be the jelly, and our basic two movements are flexion and extension. So when this vertebrae starts to bend forward over the bottom layer or to extend backwards. When this is happening, it's adding more pressure to the front of the disc, and that disc is actually going to move backwards. This is a flexion movement. So vice versa, the opposite is going to happen during extension. It's putting more pressure on the back, and the disc is going to move forward. So obviously we live in a flexion-based world, and most of the time we're getting more flexion movement and loading versus extension. So more so than not, this disc is going to possibly be moving back to more sensitive tissue behind here. And we'll talk more about that in a second. So one other thing that I wanted to note is just the anatomy of the disc structure. So the annulus fibrosus is a fibrocartilage tissue that surrounds that entire disc, the outer rim of the disc. And inside of it is called the nucleus pulposus. And this is more of like a jelly-like watery substance. And this is where it can move to a place where it shouldn't, based on these possibly abnormal loading mechanics. So let's talk a little bit more about that. Okay, so when that disc starts to move to a place that shouldn't be, and possibly we have some sort of traumatic injury that's either quick onset or gradual, it could start to tear this fibrocartilage or the annular fibrosis with these fissures over time. And this tearing, many people don't even know it's happening because a lot of these nerves are not being on set because it's surrounding the outer rim of the disc. So it's very hard to tell if this is even happening in the first place. But when it becomes a little bit more significant, we might experience symptoms such as dull, aching, radiating, zinging, numbness, shooting, pain, sciatica, or weakness. And we'll talk a little bit more about sciatica in a second. And you can feel these symptoms to many places, such as your lower back, buttocks, front, lateral, posterior thighs, or your lower legs. And the duration for this is from days to years, where you might recover or not, and it can also be episodic. So just looking at the right side over here, I just wanted to explain a little bit more about when these fissures start to become more larger. And in this disc, the nucleus pulposus is moving to a place where it shouldn't be. Okay, so this is when this starts happening. It starts to compress sensitive tissue back here, such as your peripheral nerve roots, and even moving towards possibly the spinal canal where your spinal cord is held. And like I said before, there are other tiny nerves surrounding the outer rim of the disc, and this can also become more sensitive if this tearing is becoming a little bit larger than what it should be. All right, so I just wanted to review a little bit about the different types of pain, as this is very pertinent to low back pain. So there are three main types of pain. You first have your somatic and nociceptive type of pain, which just means that there's some sort of structural damage to musculoskeletal tissue or to the skin. So this is very basic. Everybody knows this. You have a cut on your arm, you're going to have pain and an inflammatory process to follow. The second one is neuropathic pain, which means there's some sort of damage by temperature, load, or strain to your peripheral nerves. And a second category to this is centralized pain, where there's biochemical or structural changes to your central nervous system, which includes your spinal cord or your brain. And this is very difficult because it can make the pain experience in a longer duration. It is harder to heal. Our third category is going to be visceral, which means that there's some sort of damage or pain to the organs and connective tissues supporting the organs. So I'll just read this out loud for everybody. But pain is a complex system in how our nervous system relays information to the brain, and then the brain processes this information, determining how much pain and what type there is. Overall, we actually experience pain in the brain, but manifests itself as a physical experience. Okay, so let's keep that in mind. And I just wanted to show this picture about what that statement that I just said, and this explains it a little bit. No need to memorize everything. So when there's some sort of damage, and our nervous system is going to pick up what that stimulus is, and this information is relayed to the spinal cord, going up to the spinal cord, and the brain processes this information and send this information back down to that site that was injured. It's having either temperature, loading, strain, structural changes. So this is the basic pathway for nociceptive pain. Now, pain becomes a lot more, the pain experience becomes more exacerbated when we start adding in other contributors to the pain experience, which can mean that there's a physical contributor, mental and emotional, and many more, as you can see on the right side. And this is what we consider chronic pain, because it's not just those 3 different types of pain that are contributing to the experience. Okay, so moving back to now sciatica, which is more, this term is synonymous with lumbar radiculopathy, as more like healthcare providers use this. So sciatica can mean anything from the dull achiness, radiating, burning, tingling symptoms in the lower extremity. And this can encompass diagnosis such as disc herniations, spinal stenosis, foraminal stenosis, and your spondylolisthesis, spondylolysis. The most common is going to be your disc herniations. So let's move me out of the way here. So say we're having a disc issue. We'll say this is the L4 nerve root, and it's being a little bit more compressed. So the way that clinicians measure and can predict which vertebral segment is having issues is by this dermatomal map. So if we were having symptoms in the L4 area, which is the anterior lateral thigh, the knee, we can predict that we're having symptoms at that L4 nerve root region. Now, it's not always straightforward like this, because these nerve roots combine. Once they exit the spinal cord, they combine back into a sacral plexus. And this nerve, sacral plexus, it branches back into the sciatic nerve and then rebranches out to all of our lower extremity different muscle groups. So even though the L4 nerve root might be being compressed, you might have sensations or symptoms in the L5 nerve root as well. So it could vary a little bit, but most of the time it's going to stick to that dermatomal map. So how do I get sciatica with a disc issue? So one of the most common reasons for this is, of course, your trauma, heavy lifting, falls, and blunt forces. And some individuals, they might go through a traumatic injury and they might recover within a couple days or a week, and no harm, no foul. However, if we're not being aware of our correct posture, mechanics, with heavy loading again, this injury that was traumatic, and if we didn't allow it to heal for a good amount of time, this could actually become a gradual onset then, and we will still be fighting this issue, specifically with a disc herniation issue. So this is a mixed method, and this is more so than not what is presented in the clinic. But of course, this is treatable because we need to relearn good management skills, and we need to learn specific exercises for this. Okay, so our last slide for the lumbar joints and how it allows our mobility. The lumbar spine allows for 4 different planes of movement, and this is going to be, of course, your flexion, forward bending, extension, backwards bending, rotation, and then side bending. Now, if we're considering a healthy spine, our goal is to maintain the full range of movement in all 4 planes of this direction. So that's why yoga is considered like a very good and healthy practice, because it's allowing for this to happen. But if you are fighting an injury and you are in pain, this is not the goal at that time. This is just for like a healthy individual to keep your spine nice and healthy. And so it can extend for many years without developing osteoarthritic changes. And the movement at the spine happens what I call at these spiny joints. There's another correct term for this, but just for simplicity, we'll say the spiny joints this is where the source of movement happens. Okay, so moving on to our 10 tips to start your low back pain recovery. So the first tip today is knowing your red flags, and this is very helpful for knowing if you have a severe low back pain injury or a serious pathology going on. So healthcare providers use this all the time to screen out these different types of injuries. So some of these are if you're in constant pain while you're awake and it's not being relieved by rest. You have unexplained recent weight loss. There's fever or chills going on related to your low back pain. There are bowel and bladder dysfunction or sensation loss at the saddle area, meaning that you're having trouble going to the bathroom. And the last one is if you have a bacterial infection and possibly the symptoms are reoccurring along with your low back pain. Okay, number 2 is maintaining a healthy weight. So this is probably a given, but there's a lot of research to show that people who have a BMI less than 25 are less likely to be susceptible to low back pain injury and to having it become chronic. So if you're curious about what your BMI is, you can go to this website at the CDC and calculate that. So I wouldn't spend all of your energy and your focus on this number. It should be more focused on healthy eating habits and enough physical activity. And of course, if we're ambitious and we're needing to get on a diet again, taking small steps towards like long-term behavior out of self-love. A lot of the times we think of our weight and we're not happy with it and we're wanting to make these drastic changes out of self-hate versus making these steps of changes for self-love behavior. So that's the way that I like to explain it to my patients, at least. Number 3 is avoiding smoking, as this is very well known in the research that this increases a reoccurrence of your low back pain. Number 4 is providing quick traction methods, where traction means this is a type of decompression therapy to your low back. So it's allowing increased space between that intervertebral disc and possibly other tissues it's compressing. Now, the first one method I usually like to give to older individuals, and this is where you're having a sturdy cushion underneath your legs to allow your knees at 90 degrees and your hips at 90 degrees. So okay, you can use a family member to get into this position, but you should feel some sort of pain reduction with this. The second one is more for athletes or anybody who has a sturdy object to hang from above. And one caveat is that you just want to maintain contact with the floor. And ideally, you don't want to have any type of knee or hip flexion, as this may not be as effective. And the last one is more for individuals with unilateral sciatica, possibly in this picture on the right leg. So you want that right leg to hang off of the stair. And you can start with like a boot to hang on your ankle to allow that decompression to happen at the lower spine and hip. And if that's not working, you can add a little bit of weight. And I would start at something like 4 pounds or 5 pounds. Something to give you a little bit of relief. Now, just like one quick caveat, these methods are to provide relief, yes, but it's not a way to fix or treat your low back pain injury. This is just alternatives from taking pain medication. Okay, number 5 is activity modification. So we see that this is one of the best treatment methods to getting back to an early return to your work or your sport. Now, if your work or your sport is causing an onset of your symptoms, of course, we need to take away that activity and gradually return back to it so it's allowing your body to heal. All right, number 6 is getting back to normal physical activity. And I wanted to define physical activity a little bit more because this is the amount of time that you're standing or walking in a 12-hour day. So this is different from exercise. Exercise is a planned routine for anaerobic or aerobic physical conditioning. And sedentary activity means that this is the amount of time you are lying, sitting, or sleeping. Now, there's a lot of epidemiological studies saying that if individuals are going over 9 hours a day of sedentary time, we're seeing an increased risk for more chronic comorbidities and a higher increased risk for mortality rate. So we want to keep under this in totality 9 hours per day of sedentary time. Now, this is very difficult to do in this modern day world because many individuals are sitting at work or sitting at home now. And there's more research coming out on how to fight this. So what they found so far is to be every 20 to 30 minutes, we should be either one, standing up for 2 to 5 minutes, or number two, even better, to be moving around, walking for 2 to 5 minutes. And this just helps to offset that total sedentary time. Right? And there's other ways to offset the sedentary time, like going for walks intermittently throughout the day. And of course, like standing a little bit more than versus sitting. And that sitting time is going to be also very crucial for individuals with low back pain, because sitting is like the one long duration position that's adding more load to your low back. It may not feel like it, but it actually is, and this is not helpful. Okay, so knowing how to maintain good posture, and I have a past video for this, so we're going to go through this while I comment.
Okay, so our first position in sitting.
So I'm just showing of like how your middle of your ear should be bisecting your shoulder over the hip, and you can see that lower dotted curve is lost if I start slouching, and I bring my hips forward so I can have a return of that curve in my lower back, and that's what you want to try to attain and maintain.
Okay, so we're looking for the same
and the same thing in standing. If we're looking down a little bit, you want to think your chest is coming up through your sternum, maintaining that pole line position again, ear over shoulder over hip, and you can see a little bit the curve in my back returned. Same thing when we're bending over to pick something up. I have a straight back, but even more importantly, this curve is still maintained by making sure my hips are going back. Hips going back is most important versus like your knees are bending. Your knees will bend as your hips are moving back.
This is just an example of how you maintain that pole line posture.
And you can go to my YouTube channel if you want to look a little bit more on your own for the commentary there.
Okay, so our first.
Okay, and so number 8 is using different types of modalities to help, again, reduce your pain symptoms. So the different types are cold is more used for pain reduction, but remember, if the cold modality is such like an ice pack, it can only go so deep to offset that pain. You might get a little bit of relief from it, but remember, it's not going to be going as deep as like where those spinal nerves might be being compressed. Another method is using a heating modality for more so for muscle stiffness it's utilized for. And massage is also synonymous with this to reduce that muscle stiffness. Now, electrical stimulation is also a great modality, specifically for individuals using a TENS unit at home. And we found that the research has found that TENS unit is most effective when you're up and moving around, or maybe at work and you need just a little bit of relief during those times of daily activity. Now, my caveat is that there's no wrong answer to this. If something helps to reduce your pain, you can use that modality. This is just like how it was meant for and what it's seen to be most effective in the research. Okay, and number 9 is an exercise and physical activity program. So why? Every major healthcare provider and agency recommends that if you have chronic low back pain, there are 2 things you first need to have: education, and you need to have some sort of exercise and physical activity program. So along with this, medical physicians will, again, like prescribe pain medication, beginning first with your NSAIDs and your muscle relaxers first. And there's a bunch that is chosen from that category. And as we know, it can only increase to higher dosages or more stronger pain medications such as opioids and the opioid derivatives. But the first one that's recommend, those first two is the exercise and education, which you're getting today. Now, number 10 is having a specific plan and not just doing arbitrary exercises or a physical activity plan. Why? So this enables you to treat specifically a certain diagnosis. So there are specific exercises for each diagnosis, but this is also varies based off of like personal preferences, personal lifestyle, etc. And that's why it's important to have a specific program. Another reason for this is because of injury prevention and resilience. So of course we don't want this injury to come back or to make it become episodic. So we need management skills for this. And of course you want the exercise plan to be specific because you don't want to cause further harm to yourself. Now, there are two things that I can provide as an online physical therapist, and I also treat in person. But I do have an online course for disc herniations, and I also provide telehealth services through my company. So if you're interested in either of these, you can email me at this big link below, and I'm happy to get in touch with you. Hey, so that concludes the end of the low back pain presentation. I also have some other low back videos coming up with links provided if this is something that interests you. And if you found any value in this video, you can give me a like or subscribe to the channel, or you can leave a comment or question below and I'd love to get back to you. Otherwise, I just want to say thank you so much for watching and I hope to see you next time. Bye-bye.